According to the Centers for Disease Control, fluoridation is one of the top 10 public health achievements of the 20th century. It began in 1945 because we believed that ingesting fluoride strengthened the developing teeth, making them resistant to cavities. Almost 70 years after the first cities were fluoridated, over 90% of Americans still suffer from tooth decay, and we now know that fluoride is not a silver bullet. Recently, the Environmental Protection Agency added fluoride to its list of developmental neurotoxins, chemicals that interfere with normal brain development in utero and in children. And the EPA-commissioned National Research Council has determined fluoride to be an endocrine disruptor, causing the most severe harm to our thyroid gland. So whether or not fluoride in our water is benefiting our teeth, the time has come to rethink this very old practice.
7 years ago, something happened in this town. Something very simple happened. 7 years ago, something was added to this water, added to this town's drinking water. It did something to the teeth, or for them, and the children's teeth just don't have as many cavities anymore. And here's how it happened.
Fluorine is the most reactive element on the planet. And because of this unique property, fluoride quickly assumed a major role in the growing chemical industry of the mid-20th century. In the manufacturing of aluminum for giants like Alcoa, steel for corporations like US Steel, fluorocarbons for refrigerants, and Teflon for DuPont. But fluoride's most significant role was in uranium enrichment during the race to develop the atomic bomb during World War II. And the many thousands of bombs that would follow. Just months before the Second World War ended, 107 barrels of sodium fluoride were delivered to Grand Rapids, Michigan, and it made history as the first city to add fluoride into its public water supply.
There really was not ever a good study that clearly demonstrated safety and effectiveness.
Dr. Kathleen Thiessen is one of the top scientific experts in the world on fluoride. She served as one of 12 committee members for the National Research Council's scientific review of fluoride in 2006.
There were several things suspected in the 1940s and early 50s that they knew about. They ignored. They said, we're not going to talk about, nobody discussed this out loud. We're just not going to pursue these things.
Dr. Harold Hodge, a distinguished toxicologist on the Rochester team, has carefully investigated the safety of fluoridation.
Well, to put it very simply, fluoride is safe at 1 part per million. Now, we sometimes say, is fluoride poison? Yes, of course it's a poison in large doses.
We used to think about poisons in terms of dose, but now we also think about them in terms of the timing of exposure. So even a little bit of the poison at a critical time in a child's development can have lifelong negative impacts on that child's brain.
The evidence simply does not support a benefit of water fluoridation. It does support, or at least suggest, the likelihood of a number of adverse health effects, and at the very least, we need to be taking a good look at it. We can't simply say the science has been settled for 70 years, don't look at it anymore. That's a cop-out.
But entrenched beliefs persist, like a recent email from senior science correspondent Donald McNeil of the New York Times. I understand that you disagree, but I think it's fair to say that most members of the science staff of the New York Times consider this debate to have been decided in fluoride's favor about 50 years ago. Right about the time Marilyn Monroe's career was taking off in 1951, water fluoridation became an official policy of the U.S. Public Health Service. Over the next 60 years, 75% of our tap water would be artificially fluoridated, with children singing the praises of this new wonder drug treatment, the answer to tooth decay. Fluoride spread from drinking water to the multitude of processed beverages and foods containing water. From soups to juices to beer to our morning coffee, currently more than 210 million Americans are dosed daily with fluoride, making it the most widely distributed drug in the country.
Fluoride added to water is a drug. If you look at any definition of a drug is a substance that is used to prevent disease. And the only reason, the very reason it's added to water is to prevent the disease of dental decay.
It's an uncontrolled dosage. Nobody knows exactly how much any individual is getting. Nobody's checking to see if it's working for that individual or if there are any side effects for that individual. So it goes against everything we have now about informed consent.
That should concern us all because informed consent is a fundamental tenet of ethical medical practice. At times, fluoride is compared to vitamin D or folic acid, but in actuality, that comparison is completely wrong. Vitamin D and folic acids are vitamins or nutrients that we need to be healthy, and without them, we would be sick or even die. But without fluoride, we would be perfectly healthy.
We have a moral obligation and responsibility to assure that all people have the right to what it is that they're putting into their bodies.
The Supreme Court has held that all Americans have a fundamental right to refuse medical treatment. This is part of our basic liberties guaranteed to all of us pursuant to the 14th Amendment.
But refusing medical treatment in the case of fluoride is extremely difficult because ordinary household filters do not remove fluoride, and it's also in almost every beverage or soup containing water. You would literally have to stop going out to opt out of this drug. Hexafluorosilicic acid, or HFSA for short, is the fluoride chemical added to our water. It comes from the smokestacks of the phosphate industry, captured by what are called wet scrubbers put in place under the Clean Air Act to remove fluorine gas and other pollutants. This HFSA slurry is not pure, containing trace amounts of arsenic, mercury, cadmium, thallium, radionuclides, and lead. An industrial waste byproduct turned public health benefit was welcomed by the EPA's Rebecca Hamner. In a letter from 1983, she wrote, "In regard to the use of fluorosilicic acid as a source of fluoride for fluoridation, this agency regards such use as an ideal environmental solution to a long-standing problem. By recovering byproduct fluorosilicic acid from fertilizer manufacturing, water and air pollution are minimized, and water utilities have a low-cost source of fluoride available to them."
So why would we ever add a chemical that contains those neurotoxins as part of getting fluoride in the water, which is a neurotoxin in itself?
Most of the neurotoxic substances and carcinogenic substances are considered to not have a threshold, meaning that there's no level below which they're safe.
Fluoride definitely crosses the placenta. So in actuality, the dose for a fetus that is safe in terms of a neurotoxin is 0. But if a pregnant woman is drinking fluoridated tap water, she's exposing her fetus to quite a bit of fluoride, certainly an amount that's above what we know to be safe for the child's developing brain.
We have a scarred history with chemicals and drugs once thought to be safe, like asbestos and Vioxx. And known toxins like lead were widely used in gasoline, paint, and water pipes. In 1925, we thought 100 parts per billion of lead was safe to drink. In '88, it was 50, then 15. Arsenic is the same. 50 parts per billion used to be safe, then a dramatic drop to 10. In 1962, the Department of Health and Human Services recommended a maximum of 1.2 milligrams of fluoride per liter of water, but in 2015 it dropped to 0.7, a 40% reduction in what was deemed safe for the last 55 years. The current EPA goal for arsenic and lead is 0. Will fluoride follow suit as we come to grips with recent science?
It took decades to get lead out of gasoline and lead out of paint, even though we knew, or the science was clear, that lead posed substantial risks to the brain. It still took decades to get it out, and the industries that were invested in lead fought tooth and nail.
Based on modern science, most countries have discontinued or never begun water fluoridation. In fact, 97% of Western European countries do not fluoridate their water, a significant fact in light of data collected by the World Health Organization. In the United States, there was a steady decline in tooth decay from the 1970s up to 2010, and credit is given to fluoridation. So what about non-fluoridated countries, represented here by NF? Curiously enough, country after country without fluoridation has the exact same reduction in tooth decay. So what does fluoride in our drinking water really do?
We said in the NRC report that fluoride is an endocrine disruptor. It has an adverse effect on normal endocrine function. The normal function of the thyroid hormone doesn't happen, it's reduced.
The thyroid is a small butterfly-shaped gland in the neck, regulating our weight, fertility, optimal brain development, and our energy levels. Currently, 1 in 8 US women will develop thyroid disease. And Synthroid, the drug used to treat hypothyroidism or low thyroid output, is the most commonly prescribed drug in the country, with 23 million Americans needing it to boost thyroid function. A study from the British Medical Journal in 2015 shows that patients in fluoridated communities are nearly twice as likely to have hypothyroidism, supporting the link between drinking fluoride and harm to our endocrine systems.
So if you were a woman who had thyroid disease, you wouldn't want to be ingesting fluoride. But if you have fluoridated tap water, you would not be able to avoid that unless you bought bottled water or made a conscious decision to never drink your tap water.
The recent Iowa study, funded by the National Institutes of Health and Centers for Disease Control, is the largest study ever done in the US to measure the amount of fluoride children ingest. From this study, we know that children are being massively overdosed with fluoride. The study documented that 100% of infants who are fed formula made with fluoridated tap water receive more than the recommended dose of fluoride, with some infants receiving 100 times this level. 30% of 1-year-old children and 47% of 2- and 3-year-olds ingest more than the recommended dose of fluoride on a daily basis. The Iowa study verifies that it is impossible to regulate fluoride dosage through the public water supply. And it shows beyond doubt that excessive amounts of a known neurotoxin are being given to our children every single day. The accuracy of this study is borne out in your own children's teeth. According to the CDC's latest data, 41% of children in the US have dental fluorosis. African American children are disproportionately affected, with 58% having dental fluorosis, as compared to only 36% of Caucasian children. Dental fluorosis is a white or brown mottling in the enamel of our permanent teeth, and it is outward proof of excessive fluoride ingestion during tooth development.
It's an important marker because it tells us that we are overdosing our children with a drug that has significant toxic side effects.
And just in the age group of 12 to 15 years old, nearly 22 million children have dental fluorosis in the United States. Bill Moss, former head of the oral division of the CDC and current spokesperson for the Campaign for Dental Health, frequently refers to fluorosis as simply cosmetic, perhaps even attractive.
It's important to understand that community water fluoridation is effective. Approximately 25% reduction in tooth decay. It's safe. On that, I'm not going to give you any percentage because it is absolutely safe.
Would you expect the incidence of fluorosis to increase in our community?
Yes. Yes, I would expect you would have more children with white flecks on their teeth. I would expect that when you looked at those children, you would think that their teeth were very attractive. I would think you would find your children would have less tooth decay. I don't think people will complain about having more children have very mild fluorosis.
There seems to be a huge institutional reluctance to accept that we live in a different world now and that we know a great deal more about fluoride and its risks now than the world of 1950.
A landmark study from Harvard just out in 2015 shows that dental fluorosis in a child correlates directly with a lower IQ. Their results showed that moderate and severe fluorosis was significantly associated with deficits in digit span scores. Similar to mercury, lead, and flame retardants, fluoride exposure impacts a child's short-term and working memory. Of great importance to all of us, in their study, the lowest fluoride concentration in well water was 1 milligram per liter, a level that is within the current DHHS recommended level of fluoride in drinking water, our drinking water. The greater the fluoride exposure, the more severe the dental fluorosis, the greater the number of IQ points lost.
It makes absolutely no sense to expose our child to yet one more developmental neurotoxin. And I think any mother, if you ask them, would you want your child exposed to any amount of lead or any amount of mercury? The mother would say, absolutely not. But yet we give fluoride to our children every day, knowingly and intentionally. That makes no medical sense. It makes no ethical sense.
I don't care whether you're a grandparent, a parent, an uncle, an aunt, a brother. We've got to all see it from our perspective to protect not the next generation, the now generation.
So we're overexposing
We're
our
overexposing
children
most of the population, most of our children.
in the name of
With
fighting.
better teeth, half a cavity per child.
Are we willing to risk our children's brain and thyroid health for one less cavity at best? That just doesn't make any sense. We only get one chance to develop a brain, and it's a precious moment of life that we should protect and nurture in every way we can.
This moment will never come again. I know it because it has never been before. I listen to the rain outside the door. 1,000 voices singing songs that ain't been sung before.
Fluoridation began so long ago that many people dismiss it as a non-issue, but that's exactly why we should question and re-examine it. This was the same time period when Valium was prescribed to housewives. Feet were x-rayed for shoe size. Cigarettes were harmless, and nuclear testing was exciting to watch. We knew less and understood the world differently.
Here we are now, soon it will be there. Here we are now, soon it will be there. Here we are now.
The March 2015 cover story of National Geographic, entitled "The War on Science," puts people who question fluoridation together with climate change deniers and those who believe the moon landing was faked. Author Joel Achenbach labels people opposed to fluoride as crazy conspiracy theorists, referencing this scene from the 1960s film Dr. Strangelove, as if it provides proof for his dismissal of the issue.
Do you realize that fluoridation is the most monstrously conceived and dangerous communist plot we have ever had to face?
Achenbach clings to the old dogma on fluoridation, using outdated science to uphold the status quo and silence dissenting voices. That, in fact, is the real war on science and humanity. But there is wisdom in Achenbach's own words. Science tells us the truth rather than what we'd like the truth to be. In science, it's not a sin to change your mind when the evidence demands it. Maybe if we keep searching, keep listening, keep growing with the dynamism of science and quest for truth, ending fluoridation will be one of the greatest public health achievements of the 21st century. If that is the case and what is truly best for our society, for our children, will we have the courage to admit wrong and change our ways? I believe we will, but not without a fight.